This is my video presentation on Parkinson's disease. Parkinson's disease, according to the Parkinson's Foundation, is a neurodegenerative disease that affects predominantly dopamine-producing or dopaminergic neurons in a specific area of the brain called substantia nigra. People with Parkinson's may also lose the nerve endings which produce neuroepinephrine, the main chemical messenger in the sympathetic nervous system, which affects non-motor related functions. This is most likely the cause behind many of the psychological symptoms related to Parkinson's. Many people with Parkinson's also contain clumps of Lewy bodies in their brains, which usually contain large sums of the protein alpha-synuclein. Although scientists are still trying to discover the relationships between this and the disease itself, in simpler terms, Parkinson's is a disease in which healthy nerve cells in the brain are weakened, causing a decrease in dopamine production and neuroepinephrine, which creates motor and non-motor functional disorders in the human body. Some symptoms of Parkinson's disease includes tremoring, which is one of the primary and earliest onset symptoms of PD. Bradykinesia, which is the slowing of voluntary movements like walking or limb dexterity. Also, limb rigidity, impaired posture, and difficulty with balance. As the disease progresses, additional symptoms can occur, such as slurred or soft speech, trouble chewing and or swallowing, memory loss, constipation, trouble sleeping, loss of bladder control, anxiety, depression, inability to regulate body temperature, sexual dysfunction, decreased ability to smell, and restless legs and muscle cramps. In regards to diagnosing Parkinson's disease, there are currently no blood or lab tests that can effectively diagnose it. A neurological exam, which focuses on identifying a set number of symptoms related to Parkinson's in a patient, is the only known way to officially diagnose this disorder. This exam includes identifying at least 4 of the major symptoms of Parkinson's disease and will usually be initially diagnosed by a family or general practitioner. A patient would then have to see a neurologist to confirm. Identifying this disease must be done methodically and thoroughly, as there are many existing conditions that may display similar symptoms to Parkinson's. These include, but are not limited to, essential tremor, normal pressure hydrocephalus, dementia with Lewy bodies, multiple system atrophy, corticobasal syndrome, and progressive supranuclear palsy. Although there is no known cure for Parkinson's disease, medicines, therapy, and sometimes surgery can help improve the symptoms and well-being of a patient diagnosed with this disease. Medicines derived for Parkinson's are specifically formulated to target and improve dopamine production and sensory-based or psychological symptoms. Some common medications include levodopa, carbidopa, dopamine agnostics, amantadine, anticholinergic medications, catechol-O-methyltransferase inhibitors, monoamine oxidase, and adenosine receptor antagonists. A doctor may prescribe a combination of these medications to decrease symptoms and help with motor control loss. Other treatments can include visiting a rehabilitative specialist like physical or occupational therapists, undergoing surgery like deep brain stimulation or focused ultrasound, which target the brain cells disrupting motor function control, or anaerobic activities like walking, biking, yoga, and Tai Chi may help. There are also a number of theoretical remedies that may help in treating or reducing the risk of Parkinson's disease. A few studies hinted that people who consumed caffeine versus people who didn't were less likely to get Parkinson's. Green tea is also related to reducing the risk of developing Parkinson's, although this is currently just a theory. According to numerous data, there is a demographic which is statistically most likely to be at risk for developing Parkinson's disease. Populations more likely to be risk factors are men, which are 1.5 times more likely to have PD than women, people over the age of 50, people with genetic disorders linked to Parkinson's disease, people who have frequent exposure to toxic chemicals and environments, and people who experience repeated trauma to the head or brain may all be more prone to developing Parkinson's disease. Although there is no definitive way to determine who will develop Parkinson's disease or how to cure it, it is still better to catch it in its earliest stages. For people who are experiencing similar symptoms or suspect they may have it, would be wise to visit a physician or consult a doctor immediately. Thank you.